Report on Mr. Hector Gomez. He's a 68-year-old male diagnosed with COPD exacerbation and was found unresponsive in his home by his daughter. She brought him to the ER where he was having some trouble breathing. He is a full code and has an allergy to ampicillin. He has a new allergy to ceftriaxone. He initially had an order for ceftriaxone, and he started to develop some redness and a rash on his chest and on his arms. I stopped the infusion and I administered diphenhydramine. He now has an order for Levaquin IV infusion once a day instead of that ceftriaxone. He does have a history of smoking. His vitals are stable. He is sitting at 91% on 2 liters nasal cannula. He initially was at 5 liters nasal cannula, but I titrated him down due to him having some trouble breathing and being a little confused. He has an order to keep his O2 saturation between 88% and 91%. His urine output is fine. It's clear and yellow and within normal limits. No abnormalities on the UA. His other labs, his ABG initially was abnormal. He had a increased CO2 level and a decreased bicarb. His white blood count was elevated at 13,000, and his culture and sensitivity came back positive for strep and staph. His albumin is low, and he does have a anorexic, slim appearance to him. We've talked about increasing calories within his diet. He does have a laceration to the left forearm. It has a dressing on it now, and it is clean and dry with only a minimal amount of bleeding. His diet is a soft diet. He is AC and HS. His sugars have been within norms. He does have an IV in the left wrist. He's independent and up with supervision. The plan is to discharge him home with home health, and he will have oxygen therapy arranged for him to go home with him. We are sending him home with prednisone, salmeterol, and we want to increase those fluids. So just make sure that you tell him to increase those fluids if you happen to discharge him tomorrow. Do you have any questions about Mr. Gomez? Oh, I also forgot to tell you, he does have chest tube placement. He was having some trouble breathing that was worsening, so the doctor recommended that we get a chest x-ray, and it came back that he did have some pleural effusion. So they did do a chest tube placement on the left side. It's draining fine, and I've marked the last where I have documented. I've went over some teachings with him about how to use the incentive spirometer already, so just want to keep that in mind. I think that is everything. Do you have any questions for me? Okay, you have a good night.